Good morning and welcome to your weekend healthy chat. I'm your host, Dr. Sara, and please join me in welcoming today's guest, George Geisler from the Eastern PA Law Enforcement, who's involved with Team DUI. Good morning and welcome.
Good morning. Thank you, Doctor.
No, thank you for being on the show. So let's get started. So what is Team DUI?
The Pennsylvania DUI Association is a not-for-profit professional association which provides technical assistance to everyone in the DUI industry, if you will, anywhere from education to the law enforcement officers to parole, prosecution, anyone in the criminal justice system other than defense attorneys who are working in the field of the impaired driving discipline.
Mm-hmm. And how did you get involved?
My particular job is I work under a contract with Pennsylvania Department of Transportation to provide technical assistance to police officers all across the Commonwealth, whether they're state, municipal, conservation officers, or whoever, in their work in impaired driving.
Okay. And what are some of the objectives of Team DUI?
Well, from the law enforcement standpoint, certainly it's to teach our officers to recognize, apprehend, and successfully prosecute DUI offenders, whether they're on the prescription medication which is impairing, whether they're impaired by alcohol, whether they're impaired by any other drug. In the Commonwealth of Pennsylvania, the term drug is defined as any substance other than food intended to affect any structure or function in the human body. So that can be over-the-counter drugs, that can be prescription drugs, it can be illegal drugs, designer drugs, and then, of course, your other drugs, anything that you're inhaling or otherwise ingesting which can impair your ability to operate a vehicle safely.
Okay.
And then we have other disciplines. We have the Ignition Interlock Quality Assurance Program, where we, again, are under contract with PennDOT to make sure that the ignition interlock providers in the Commonwealth of Pennsylvania are functioning properly and providing good services to those who need that.
What is ignition? Yeah, what is that?
Well, the ignition interlock is an instrument that's installed into a vehicle owned by the person who's been convicted of their second and subsequent DUI offense, to prevent them from being able to get in the car and drive under the influence. So the first thing that they have to do when they get in the car is to blow in the device, and that device will not allow the car to be started if, in fact, they are under the influence of any kind of alcoholic beverage.
Okay.
And then throughout the course of their driving, it will call for a rolling breath test every 20 minutes or half hour, depending on how it's set up, to, again, make sure that that person is not driving under the influence of alcoholic beverage.
Now, I know that there are some other initiatives besides the ignition interlock that are taking place to prevent DUI. Can we talk a little bit about those, such as like the safety bug or the safety simulator?
Absolutely. We have a preeminent safety program that is designed to educate our young people in the high schools who are just getting their driver's license. Our safety simulator is a classroom on wheels, and basically what it is the computer-operated simulation of driving an automobile, much like pilots train in flight simulators. This safety simulator is taken around to schools and other community events, and it's an opportunity for the young people to sit behind the actual controls of a vehicle and function as a driver under varying road conditions safely, and then we turn the computer in a different direction to make them drive impaired, and then they can see at
what that actually is like. Yeah,
that's right. And it was interesting when my son was a senior in high school. I had the simulator at his high school, and several of the young people that I knew from his school got out of the simulator and said, "Wow, Mr. Geisler, I had no idea that you could be that impaired with just that little bit of alcoholic beverage in your system. I'll never drive under the influence." And so I was very tickled to hear that.
Yeah, because it shows it's going to make a difference.
That's right. And then the safety bug is we have two vehicles that are outfitted. One is a VW Beetle. It's outfitted with some equipment that we can take the children around in a parking lot and drive through an obstacle course with cones let them drive through once when the car is functioning as you would as a normal driver, and then we can make it function as though you were under the influence of an alcoholic beverage to the degree that you were incapable of safely driving. So they can see what happens when you oversteer or short brake or fail to brake or whatever the conditions are, and of course they hit the cones and so on and so forth. So
Right.
it's a realistic hands-on experience. Both simulator and safety bug are very realistic, but there's nothing like actually driving a vehicle in an obstacle course and seeing what happens when you're impaired.
Yeah. It would be nice to have some of those things when we were in high school. How long have they been out there?
They've been out there for probably close to 20 years now.
Wow.
Yeah, about probably 16 to 18 years.
Now, I'm sure that they're definitely making a difference, as are you.
Oh, thanks. We often hear from our as I travel around the state and teach the law enforcement officers and help them with their DUI at work. Hey, Mr. Geisler, I remember when the safety bug came to our school. What a cool experience that was, or I remember the simulator. So you do hear that, and it's very nice to hear that because there's young people that went on to be law enforcement officers. They obviously are making a difference, and hopefully our program made a difference with them.
No, that's great. Absolutely. Before we end, any final tips for driving safely when alcohol's on the agenda?
Well, I think it's important that we understand that today everyone's getting the message that alcoholic beverage intoxication while driving is socially unacceptable. We're seeing a decline in the number of DUI arrests, as we should, and
Right.
it's reflected in the number of fatalities. Last year in 2012, we only had, and I say only, 404 fatalities, but 10 years ago when I started with the association, it was well over 700.
Oh, wow.
So the general public is getting the understanding that it's not safe and it's not socially acceptable to drive under the influence of alcohol. Where our challenge is today is with the drug-impaired driver, and I think it's very, very important for everyone to understand that DUI is not just alcohol anymore. It's alcohol and drugs of any kind.
Absolutely. Even when they say you cannot operate heavy machinery, so many people don't realize that that's actually a car.
Oh, absolutely. And you know, when you're taking prescription medications, particularly, you know, follow what your doctor says, and if your doctor doesn't give you any warnings, read what's on the bottle. It often says, "Do
Ask
not
your
drive."
pharmacist.
Yeah, exactly. Or it says, you know, when you're first taking, particularly now with our older maturing population, the average American takes 13 prescription drugs a year, according to the Kaiser Family Foundation. Older drivers, as I am, I'm 58, we must understand that when we take drugs that are prescribed, they can affect us
Absolutely.
for the first couple weeks until our body gets used to it, unlike it did when we were young.
Right. Absolutely. Welcome back. We're going to switch gears a little bit. We just had George Geisler from Team DUI. And now, please join me in welcoming Kyle Wright, who is the coordinator for the Pike County Advanced Life Support Program. Good morning and welcome.
Good morning. Thank you for having me.
So let's get started. So what are the goals of the Pike County Advanced Life Support Program?
Our primary objective is to provide pre-hospital emergency medical services to the residents of Pike and Wayne counties.
Okay, so you're covering both areas.
Correct.
And what type of services do you provide?
Traditionally, paramedic services. So in addition to the local ambulance services that provide service to each individual town, we come on board their ambulance and provide advanced life support. So things that are in addition to what the local ambulances can provide.
And who would contact you? Is that through like the local ambulances saying, hey, we have a situation here, we need a little bit more support? Or is it something where you're contacted first from whoever called 911?
It's done one of two ways. The first way is a local ambulance can get on scene and say that, you know, this is kind of out of their scope and they need some additional help, and then they can call us that way. Or the 911 dispatcher, when you call 911, will ask a series of select questions. And
like a triaging, if
correct,
you will.
and determine if that patient may require
More.
advanced life support or paramedic services.
And what do we mean by advanced life support, just for the listeners?
Well, the local ambulance services primarily provide transportation to the hospital, CPR, and some basic splinting, as well as oxygen therapy. Advanced life support services are beyond that, and we have the capability of inserting endotracheal tubes, which is a tube down somebody's throat to help them breathe, to start an IV and give fluids, as well as to start an IO, which is essentially an IV but through the bone, and some other advanced airway techniques. And our units carry approximately 40 different types of medications and IV solutions.
Oh, great. So quite advanced, if you will.
Yes.
So how did you become involved? Or what sparked your desire, I guess?
I actually became involved by volunteering in my community for my local ambulance service, and it was just something that I felt I wanted to continue with my education, and I became a paramedic, and here I am today.
Very nice, very nice. So I know you were recently recognized by the Pennsylvania Voluntary Recognition Program. Tell us a little bit more about that.
Well, this is a program that was started last year in Pennsylvania, and it essentially was a pilot program because it's the first time that Pennsylvania is ever doing it. And what that did was set some standards for ALS services, advanced life support services, that wanted to receive this accreditation. They had a couple levels, and you'd have to meet certain criteria in order to do that. And we were one of 41 initial organizations in the state that were able to receive that accreditation.
Well, that's great.
Yep.
Well, congratulations
Well,
on
thank
that.
you very much.
So now I'm a pediatrician, so I understand you have some pediatric-specific medical equipment on your ambulances. Can you tell me a little bit more about that?
We do. In fact, starting in 2011, before this program started, we kind of tried to gear a little bit more towards pediatrics. In 2011, we started carrying Tylenol on our ambulances, and that was new. That was new for our paramedics because with febrile seizures, which is a seizure in which a pediatric patient is experiencing because they have a fever. We would traditionally treat the seizure and not treat the what's causing the seizure.
Yes, absolutely.
Right. So we've been trying to gear towards fixing the actual problem, not necessarily fixing the symptom. So we started carrying Tylenol, and so that started a little bit in 2011, and now with this program, which was sparked a little bit by the closing of Bon Secours maternity ward, that kind of sparked it in the back of our head a little bit that we needed to be a little more prepared. And then this program came out, and we thought, oh, this is great. So we applied for the program. We had to make a lot of changes in our organization in order to accompany it, and here we are today.
So can you place endotracheal tubes into young kids, even infants?
Yes.
So you have all the equipment?
Yep, we have smaller endotracheal tubes and a lot of pediatric specific equipment, and including medications, that are already to that pediatric dose equivalent, instead of having to do the math in the back of the ambulance. Right, in that situation. And not only that, but through this program, we received 2 PediMate devices which help us transport pediatric patients, and they're about $500 a piece. So we were happy that we were able to receive those through. Yes. Yep.
And what do those devices do?
They actually fasten onto the ambulance cot.
Okay.
So it's safer for the patient to be, instead of
specific.
being held in the mother's arms on the way to the hospital or something. So it's much safer.
Now, I've also learned that the providers that you have experience or background checks, child abuse. They have to complete several hours of pediatric education annually. Can you talk a little bit about that?
Sure. And that's part of the requirements through that program. And the biggest and the most difficult thing for us to do is to get these background checks done. And we do traditional background checks for, we do the FBI fingerprinting, et cetera, like most healthcare organizations. However, with this program, we had to have the Pennsylvania Department of Public Welfare investigate every single person that works for us, and they had to list all of their addresses that they lived since 1975.
Oh my God, I think I would forget.
Yes.
I swear in medical school I probably moved around so many different times between that and residency. I would have no clue. All the different
and the Department of Public Welfare went back to each of those counties and each of those states just to make sure that there was no child abuse
That's a great system to have. Great checks and balances, if you will.
That's correct. And as far as the education component, we, for the last couple couple of years have required triple what the Department of Health requires in order for an EMS provider to maintain their certification. However, we didn't have a specific requirement for pediatrics.
Okay.
So with this program, we have a specific time allotment for pediatric training.
And now, does that mean PALS or Pediatric Advanced Life Support?
Yes, our paramedics are required to have PALS. The EMTs that don't perform advanced life support services that work for us are required to have a certain pediatric portion as well.
And what hospitals do you bring patients to? Is it just Bon Secours and Wayne Memorial, or do you go to wherever whichever facility?
Well, the two closest local facilities to Pike County is Bon Secours Hospital and Wayne Memorial, and they're local care facilities. But we do try to steer the patient in the direction of the hospital that's going to be able to treat them most appropriately, instead of them having to be transferred to another hospital.
Right. So try to cut out the middleman if it was something that
Correct.
Right.
Correct. And, unfortunately for us, the closest pediatric trauma center in Pennsylvania is all the way in Allentown.
I heard.
Yes. So
it's quite the distance.
That's correct. So we do use air medical transportation quite a bit with pediatric patients.
Now tell us a little bit about your pediatric-specific community outreach programs. What are they and how can we access them?
Well, we've done a lot with events that were already in the area. So throughout the year we did, in 2013, we did the Pike Wayne Resource Fair at the Wallenpaupack School. Okay. We did the Wayne County Fair. We're doing a couple events like that, but integrating our component into it. So we would bring, CPR dummies and stuff like that, and just try to grab people as they were walking by, and you know what I mean. And if we educate them for 3 or 4 minutes, it does have the opportunity to possibly save someone's life.
Yeah,
correct.
Absolutely, absolutely. Now, I understand that Pike County Life Support is only one of 3 ambulances in the Northeast PA to be recognized, and the only one recognized at the master level. So congratulations, first and foremost, but can you describe the various levels and what that means to have the master level?
Correct. We are the only service recognized at the master level in both Pike and Wayne counties. And they do base it on levels, and with each level, they add another requirement. So the first level is the equipment requirement. Okay. The second level is in addition to the equipment requirement, there's the background check requirement. In addition to that is the continuing education requirement, and then in addition to that is the community outreach requirement. So we've met all of those performance markers. Yeah. We're really happy about it, and we're hoping to use it as a recruitment and retention effort, for our employees, because they can be proud of the service, and the community can be proud as well.
Well, thank you so much for coming on and discussing the life-saving work that you're doing. So we really appreciate that.
No problem, and I really appreciate you guys taking the time to speak with me.
Great. Well, we'll be right back after this. And now it's time for our email question of the week. And this comes to us from a concerned mom. And she writes, "My daughter, 3 months old now, has continually had dried mucus in her nasal passages. Any thoughts why this is, and how can we remedy?" Nasal passages from newborn period throughout infancy are tiny. We're talking pinpoint-like. Therefore, any particle that enters the nose, such as dust, perfume, what have you, can cause irritation, and the mucus secreted serves as a protective mechanism. Also, keep in mind, infants are obligate nose breathers. Therefore, even the slightest increase in mucus will sound loud and congested. Now, if the mucus worsens, you want to keep the head elevated, even at nighttime. And you want to start nasal saline drops as well as suctioning. If fever develops or the congestion worsens despite the above measures, then please contact your pediatrician for further advice. And I hope this helps. For those of you with further questions, please feel free to contact me at Dr. Sara at middletownchc.org. Again, that's DRSARA at middletownchc.org. I would just like to thank our guests today, George Geisler as well as Kyle Wright, for being with us today. So thank you very much. And I hope everyone out there has an active and healthy week ahead, and I'll see you again next time. Take care.